Right, I am Ginille. I'm a cosmetic nurse practitioner. I've been injecting Botox fillers since 2013. Let me know if you have questions. You can jump in. I have a little box where we can do your consults live if you would like. In the meantime, I can talk to you about our practices. I can talk to you about our patients. I can go through your specific questions, or I can go through the most commonly asked questions that I hear from patients that I've been seeing. So I've been doing this again since 2013, going on 13 years here. I have 3 practices. We have 2 locations in Los Angeles, 1 in Las Vegas. We really focus on treating all skin types, all skin tones, getting natural looking results where it looks like you, it looks fresh and never overdone. I want to showcase and highlight, I'm trying to scroll through here, just some of our patients so you can see the results. And yeah, if you have any questions, let me know. I can talk through the patients we see, and I'm just going to flip through a couple. Stop me if you, I'm going to make these bigger. Stop me if you have questions. I don't need to be so big. Stop me if you have questions. And the main thing people want to talk about when I come on live, they want to talk about under eye filler. They want to talk about natural filler. Oops, I did not mean to do that. Natural filler. So let me know anything they want to talk about. Treatments they've done, facial balancing. We really focus on treating the entire face. We're not just spot treating. We want to make sure it looks like you, it looks fresh, never overdone. So that is what we focus on. And let's go through patients. So, and here's some more. Oh gosh, I got to set up these before and after. So give me a second. There we go. Again, treat all skin types, all skin tones. And this is a patient who came in, he just felt like he looked tired. He wanted more of a angular jawline, more chiseled out, more masculine. So we gave him some width by doing filler to his lower face, made his chin look a little bit more square. And then we did some filler into his mid face. So just giving him a refreshed look. We lose volume as we get older and when we lose weight. So when we lose weight, a lot of people are losing weight right now, especially with GLP-1 medications on the market, Ozempic, Zepbound, Mounjaro. Patients are losing weight and they're noticing changes in their faces as well. They will notice under eye volume loss. They will notice smile lines getting deeper, the corners of the mouth getting deeper, temple hollowing. And so when we are treating, we want to look at how the face is aging, where that volume loss is, and replace it where it still looks like you, not overdone. Okay, if somebody wants to jump in here, feel free to ask me any questions when you're on here. We can do consults, and I will jump in here. Feel free to ask me any questions when you're on here. We can do consults, Lily, and I will jump in here. Feel free to ask me any questions when you're on here. We can do. Can you hear me? Jump in here. Feel free to ask me any questions when you're on here. With you. If you have questions, Lily, let me know because I think right now I was just hearing myself. Can you type me in the chat and I can put a request for your camera to go on? And oh, you says you don't have access to video or microphone if you have questions. So yes, I have patients that come on here. We can go live. They will ask me their questions. We can go through a consult. I also do virtual consults and in-person consults. My team and I do this in office or online. You're going through your questions, your goals, tips on what to expect, how to prep for treatments. So we see patients from all over, not just the US, outside of the US. Every day I'm in clinic, I've seen somebody from outside. So please let me know your questions. Hi, T-Bags, hope you're doing so great. Okay, what's the name of the Vegas location? I was ready to hop on a plane. So my clinic has been under my name since I left on my own in 2021. It's been under Ginille Beauty. We are rebranding it because it's not me. I have whole teams of providers in the offices that I've trained and worked with for years. So now our clinic is under Jasi Skin. It's Jasi skin.com. Our website is being updated by the end of this month. If you want to see us, you can hit the link in my bio to do a virtual consult or the number. If you text the number in there, you can send me your pictures, you can ask questions, we can send you pricing, info on financing, and then we can help you with getting coordinated. So the number on the profile is like going to be the quickest way as we're transitioning the name into Jasi. Okay, let me see if I have, Lily, how can I do a consult with you? Let me see if I can unmute you here. I was hearing just feedback on myself. Can you hear me? Lily. So Lily, we can talk on here if you want, and then we can do virtual consults.
Lily.
Like if
So
you
Lily,
just
we can
get
talk
my
on
data in
here
front
if
of
you want,
everyone. Can you hear me?
and then we can do virtual
I
consults.
just keep hearing
So
myself
Lily,
when
we
I
can
turn
talk
you
on
on,
here if
Lily.
you want,
Can you hear me?
and then we can do virtual consults.
I just keep hearing
So
myself when
we
I
can
turn
talk
you
on
on,
here if
Lily.
you want, and
Lily,
then
I'm
we
going
can
to turn it
do
off the microphone because it's
so
just doing some feedback. But and it says right now, it says your camera is not connected. I'm going to try one more time. It says you don't have access to join with camera. So I tried to hit your camera on, but people will come on and then they'll show their face if they want. We can talk through questions, or you can do a virtual consult. If you hit on my page, if you hit on the main link, that's where you can set up a virtual consult. And I can try again, but every time I turn the microphone off, Lily, I just keep hearing myself talk, and so I can't really see what's going on there. Or if you want to type your questions in there, and I can also talk through. Oh, yeah, I'm so sorry. It has worked, and I've done it like every time I go on live. Yes, 2 locations in Los Angeles. So I've been injecting as a cosmetic nurse practitioner since 2013. I have 3 medical spas. 2 are in LA, Mar Vista, Torrance, and then in Las Vegas. So I was in Vegas yesterday, and then I saw patients today in Torrance. I see patients in all the clinics. We also have teams, like whole teams of providers that are excellent, get beautiful results, and you can come and see any of us here. I will flip through some more photos of this is a patient. I saw her yesterday for a follow-up in Vegas, but this is like one of her previous photos that we've done. We've been together for a long time. This is Christina. She's made videos. She's shared about what we have done. Here we had done a little bit of filler into her lateral cheek and then into her chin to bring forward her chin and elongate her jawline. We've also done filler in her lips and Botox. We've done different treatments. Yesterday we were doing some skin treatments. We were filming about that. She is, I don't know exactly what you want to call it, but like a bodybuilder. I feel like she looks like a Victoria's Secret model. She's so beautiful. And she for her bodybuilding, she just wanted like a little bit more highlight on her cheeks and again, elongation to the jawline. She wanted lip filler, but I was like, hey, we don't want to just do lips and have the lips really full and then the lips go beyond the chin. So we want to make sure we always have the lower face support and we're not like spot treating the face. That is how we make sure you look the most natural. Okay. And yes, it looks like her. She looks fresh. This is after it's settled. So it takes 6 to 8 weeks for your filler to fully settle. 2 to 3 weeks, you can be bruised, swollen. It'll kind of chill out. But the 3rd week, you should have a good idea of what the results are settled as. You still just might feel some of the filler until 6 to 8 weeks when it settles out. And somebody's asking how much into her chin. We did 1, and we did 1 per side on the cheek. So that's 3. And then in her lips, she had done 2 halves. So this was like 4 syringes kind of split up. But still, I feel like it looks like herself. And this is from a few years ago. However, I think I posted her on my stories yesterday, and you can like go to her page and she's posted about it. I was like, freaking Christina, you look so good. Like you look the same. And that's the goal. Like we're getting older. I still want it to look like you. I want it to look fresh, never overdone. That is what sets us apart with what we do in our office. And she said in Vegas. So Vegas is our newer location. She's like, in Vegas, like a lot of people just look overdone. She's like, we don't have a lot of providers out here that are doing natural looking work. So like people want it, but she's like, then they don't look that great. So, I mean, she kept coming to me, even when she moved to Vegas in like 2020, she kept coming to me in LA. I had a lot of patients saying that we see from Vegas. And so I was like, all right, let's make a clinic in Vegas. And she's like, yeah, the people, like their skin looks weathered. They're not taking care of their skin and their injectables look overdone. And I've heard that sentiment from the patients that come and find us in Vegas that are not already my patients that I've been seeing for years. Okay, somebody said, accept your request. Let me do this, really, 1 second. Accept, and then let me see if I don't hear feedback of myself. I know that was happening earlier. Okay, do I do anything to her nose? She has done, she got nose filler or nose job, one of them. I did not do her nose in this specific photo though. Okay, really, let me see if I can
Oh my
talk with
God, this lighting is horrible.
you.
Um,
Can you hear me? Yes? I hope I can hear you. This is not RHA filler. This we had done Restylane lift in her cheeks and her chin, and then into her lips. Oh, give me a second. It might have been contour or velour. Different products depending on the goals and who I'm treating and what part of their face. Hey, Riley. Am I saying
Hi.
it right?
Yes, it's. Ooh,
Nice to see you. I made you
hi.
big so I can see you. I'm
Nice
glad
to
we can
see
talk. So
you.
we can, yeah,
I
go
love you.
ahead.
I've been following you for. Can you hear me?
Yes, I can hear you.
Okay. I love you. I love your work. I love how authentic you explain everything. Um, I just turned 40 6 months ago, and I have wanted to, and I've lost a little bit of weight. I wanted to do my concerns are my nasolabial folds and my
Okay.
under eyes. I've just noticed like they're kind of worsening over time. I did
Okay.
do PRF a little over a year ago,
Okay.
but literally saw virtually no results. But I kind of wanted to do, I guess, like some sort of like facial balancing and just kind of do like I feel like I look tired.
Okay.
And
And then,
so I'm not sure. I feel like you're genuine and honest and not, and it's not like a money grab and saying, oh, you need this, you need that. So I just wanted to get like your assessment. Like,
okay. Besides the PRF underneath the eyes, did you do any other treatments before?
I have had Botox twice,
Uh-huh.
like a few years apart, and I recently got Botox to my masseter because I do clench my jaw.
Okay. How have those been for you?
Great.
Those been
Love
good.
it. Yeah.
And it helps with your
Hmm.
symptoms and stuff in your jaw?
Absolutely. Yeah. I actually went like a really long time since I did the mask. So it was just kind of like it was really inflamed by the time I did it. The Botox, I like the results. I'm okay with a little movement. Like I haven't had it in over a year, so I'm okay with it.
Okay.
But like my main issues, like like my under eye, my nasal labial folds, which this kind of started, like I feel like my early 30s.
Uh-huh.
And also I have very, very big cheeks. Like
Okay.
I really want to do a buccal fat removal,
Uh-huh.
but I don't, everyone keeps saying that'll age me, so I don't know. But I know I have plenty of cheek fat
Cool
to
there.
spare. So
Okay. And then is this your normal weight or have you recently changed weight or planning to change weight?
I I have had some unintentional weight loss. Like it never happened in my life. I've always been thick, so I'm about like I'm the smallest I've ever been in my
Okay.
adult life. So I'm like 118 right now.
Okay. And you
Normally I'm
think you
like
might change?
one, huh?
You might like go back up or do you
I
think
not so much go back up. I'd rather like be because it was unintentional weight loss, so I'd rather kind of like tone up as
okay.
opposed to like gain weight. So I would be okay with, a few more pounds, but it's just like the lack in muscle tone and stuff. That's
Okay. And then underneath your eyes or anywhere in your face, do you get puffy? Do you swell? Do you retain a lot of water?
Mhm. Yeah, I
Under
do.
your eyes, you do?
Um, yeah, like in the morning, like especially if I haven't slept, I feel it.
Okay.
Um, I do get some relief from like like lymphatic drainage and stuff like that, but I'm not the most diligent. And I heard someone say yesterday that they get puffy when they drink, and I have wine like nightly. And I
Hmm.
do notice, even though I'm puffy now, I haven't had any wine, but I do notice that it feels fuller and looks fuller to me.
Okay.
So,
And then, so first off, with you like getting any water retention around the eyes, getting puffy, do not put filler by your eyes because it
okay,
can swell up and down. Now, filler is going to
okay,
help with like volume loss, sunkenness, anyone hollow. It's going to give you like that immediate little lift, but you want to make sure you're the right candidate for it. If you're not, it can be there for a long time and it'll swell up and down with you. So in the morning times, if you're naturally puffy or if you drink, it would be worse. So you don't want that.
okay. Uh,
And you said you did
and I
PRP
cry a lot. I'm
and
a
you cry a
crybaby.
lot. Okay. Yeah. So you know all the ones to just avoid filler.
Well, I just heard
Um,
that from you yesterday. No one ever told me.
yeah.
I didn't know that. Yeah.
Anyone with bad allergies cries a lot. If they tell me they wake up and they're puffy, anyone that has like water retention here, I'm like, it's not worth it to me for the patient because like if you put that filler there, it's just there's a strong potential that it could swell up up and down, and it could look not good. And it can be there for
Even
a
if
long
it's
time.
PRF,
PRF, you're okay. But
that's
regular
what I
like
did.
traditional
Yeah, I
filler.
didn't do filler. I did PRF.
Yeah. So regular
but I
fillers, when
didn't.
somebody tells me, like you said, you didn't see much change with it. So when someone is like sunken hollow, there's like you can do regular filler or you can do the natural one, the PRF. You did that this one time,
Uh,
the
yeah,
PRF.
it's been over a year, and I mean, I for I don't remember seeing any results. Like I kept taking pictures. I don't know what I expected, but I didn't feel like I looked any different.
And did they do the PRF where they just draw your blood and then inject it, or did they also heat it and it makes a gel?
I don't know. I don't know. She heated it. I don't know. I don't think no, because I just heard about that when you started explaining it. I think they just injected just the blood,
Hmm.
the fibrin or whatever.
So this is just taking it a step further. We've been doing it in the States for like 3 to 5 years. However, abroad, I was hearing about this at conferences when I was going to aesthetic conferences. Like all the people that were international were talking about they take their PRP or their PRF and then they heat it and it makes a gel. And so it makes the stem cells, the growth factors, they were like, we see more of it. And it gives the people a little bit of an immediate lift where they can like see some lift. Whereas PRP, like I feel like the next day you don't really see too much, it kind of goes down.
Uh-huh.
They were seeing better response with collagen stimulation. So that is what we do in the office. You can do we do the same process of like drawing it, spinning it, and getting the PRF and the PRP. But when we heat it, that's where it thickens and makes a gel. And so people see a little bit better results with that than just if I only spun it and I didn't heat it and injected it.
Okay.
Um,
Okay. And would
with
that be the
that,
same for the folds?
you could do that in your folds, or if you don't get puffy through here, you could do regular filler if you want. So I like the the Easy Gel, the natural one. I really do. When I first
Mhm.
started it, because I've had regular PRP. Remember, I've been doing this for like almost 13 years. So regular PRP, I'm like what you're saying. I don't really see any change. Even when I did the natural, like the heated gel, at first I was like, I don't see any change. Over time, I saw it. It got better. I was like, oh dang, I haven't had filler for 3 years. And I love filler, guys. Like I love it. This is what I do for work. I'm just breastfeeding and I'm pregnant. I was pregnant. Um, and so like the natural, and I'm like, dude, I'm now 38. I have 3 kids. I've breastfed them all for 2 to 2.5 years. I know I usually get really sunken. I lose fat in my face. And so all those spots, I've just done the natural filler. And I'm like, I don't look as haggard this time around than my other two. And I'm older. So
Right.
it works. It takes more than one session. So that is another thing. Like people be like, I just want to do one. I'm like, it's not just one. Like
Yeah, it
we
was pretty painful. That's why I was
was
disappointed with the
painful.
results.
Were they
And I
do
had
you
like,
be that bad? Was it like with the
I'm not the best.
oh with pain?
I don't tolerate pain that well, but it was pretty painful, but I'll take it. And
Uh-huh.
then I had like pretty bad bruising.
Okay.
It ended up being fine. It resolved.
Okay.
But I was just kind of like, like
With
underwhelmed with
yeah.
between the results and
So this is why we'll do the consults before because we'll tell people like, yeah, you can bruise, you'll swell. We have people prep before
no,
they
I
even
know
come
that. I'm a
in.
nurse as well, so I knew
So we get
that.
it.
I wasn't
So
surprised. I just wanted to make sure it was
yeah.
okay.
But even you take arnica beforehand, eat pineapple. I would like pause on the wine beforehand, just it'll help. And then you gotta plan it before before any major thing. But
Right.
also keep in mind this will get better up to 6 months later, like your body. So I'm like,
Okay.
the healthier your body, the better the outcome. Like 20s to
Okay.
40s, the patients there, they really like this. Even 50s, but 50s they'll start to do like a few more sessions in the same area. 20s to 40s,
Okay.
even with 2 sessions, they like it, they can see it, like they can tell. It's not as quick as like some of these transformations that I can show like immediately after and like more of a lift because I don't have as much control on somebody's body to make collagen. But for
Right.
you, like non-surgically, I would just not do filler. And so in what we can do is the natural filler. You could also consider like fat transfer. That's a surgical thing. But I tell people, I'm
Hmm.
like, just make informed decisions. So if you're open to surgery where they like can, go talk to
Oh,
us.
I'm open to a bluff if needed. Like I just don't know like if that's the best
I don't
route.
know if
Like
I'm not surgeon, so I don't want to talk like too out of my lane. Bleph is
okay,
they're usually like
okay.
taking the fat pads and taking it out. That's if they have eye bags or tightening it.
Hmm.
If it's sunken, it's more of like volume replacement. So that might be the fat transfer. So
Okay.
That's a thing. Even with fat transfer, I've had some patients tell me they've tried that and they're like, hey, like some say it worked great. Other people are like, it didn't stick. Like, they might need more than one. But those are the
Mhm.
options. Just veer away from filler. Here, if you don't get puffy, you can put filler, or you can do the natural filler, or you can consider the surgical like fat transfer as well.
Okay.
Um, yeah, I like them. I think it's great and the patients love it. And you can't go wrong with it. You're not going to have the issues with it getting the potential issue of it getting puffy up and down.
Okay.
And then can I see from the side profile? And then the other side, and you said you might get a surgical consult for like the fat removal in the lower face.
I I definitely want to do that without a doubt.
Yeah.
I'm still shopping around, but in the meantime, I mean, I saw you were going live and I'm like, oh my gosh, she's taking people. So
Yeah.
I just wanted to take the opportunity. I love your work. Been
Oh,
following
thank
you
you.
forever. So,
Yeah, if you think of
so
anything,
is
always
your
text.
location in Torrance the same name? Okay.
Oh yeah, if you look under, if you Google my name, Ginille or Jossie, you'll find it. But like in
Okay.
LA, the
Okay.
clinics that passed since 21 has been under my name, Ginille. But now I'm just like, I've got a team of people. Like it's not just me, so that's why we switched the name over. But like this, the name is like the name switch is happening now. So
Okay.
our current website is under Ginille Beauty. It's Ginille Beauty. Or the new website, which would be the end of this month, is Jossie, and that's where everything is switching over. Oh, can you
Okay.
hear me?
Okay.
Really, just
Thank
text the
you.
number, and like that's where we'll get
Yeah.
it. We'll help out. Okay, I'll
Okay.
see you. I hope you have a
Okay.
good one.
Thank
Talk to you
you.
soon. Bye.
Thank you too. Bye.
Okay, let's see. Uh, the name of the office in Torrance is Ginille Beauty or under Jossie Skin. And then there was somebody else in there I was trying to add. If you want to come back, I think it was Tasha. Okay, more natural looking lip filler, please. Okay, I will show you some before and afters that. Do you have a person of darker oh my goodness, I've done all the complexions. We'll go through these are just like some photos I snapped on my phone, but I'm gonna flip through these really quick so you guys can see some patient before and afters. I'm gonna make these a little bit bigger. I will do like a quick little run through of what we've done in these. I treat all skin types, all skin tones, our whole team. This is what we do. I'm Filipino and Black. If you look at our team, it's very diverse. We treat people of color. We treat everybody. And not everyone can say that in the aesthetic industry. So you want to be careful with who you're seeing when you're getting your face done. We can't treat all faces the same. We don't want all the faces to look the same. So I'm going to flip through these. I will go quick. She did nose filler here to camouflage the bump. He did filler along his jawline to make his jawline, he wanted it more masculine, like more square. She did lips. Yes, Black girls do lip filler too. She told me brat doll's lips. She wanted really full lips. A lot of people are like, do Black girls do lip filler? I'm like, yeah, she wanted full lips. Here we go. Here's a white girl that did lips. She has naturally really cute lips and she liked her shape. We just wanted a little bit fuller. Sujia, you guys have probably seen her on here. We have done her whole face. We have made videos about it. She has done her cheek filler. I've done her smile lines, her lips, the corners of her mouth, her chin along the jawline to camouflage the jowls. We've done Botox all over her face. We've done some skin treatments. Here is a side profile. So again, I've showed you all the people. She's younger. She felt like she looked tired after law school. We softened under eye hollowness. She wanted a little cheek. So we did a little under her eyes and it kind of feeds into her cheek as well because those fat pads separate. We did some lip filler and then we did her chin. It was a little more square and she wanted it rounded out. Still looks like herself, looks super fresh. That's the point. All right, she wanted the tip of her nose to be lifted up. She wanted to camouflage the bump, and you can do your nose straight or you can make it lifted. You can keep some of the bump. Like we can really customize it to you. She wanted her upper lip to have a little bit more fullness, so the ratios are equal in the upper to lower lip ratio. We did under eye filler, and then we did filler to her chin to elongate her jawline and help the chin so it's not like set back. All right. She came into me after she lost 100 pounds. We did under eye. She said, I lost 100 pounds. She's like, I love the way my body looks. My face looks different. She did under eye filler. We did filler into her cheeks to create more of a highlight. I have another version of her, like another view of her. I just don't think I have it snapped on here on the quick ones on my phone, to create more of a highlight. We softened some smile lines. She wanted her lips to be a little bit fuller. Again, naturally, Black girl has full lips. She already had them. And then we did some filler into her chin because the chin set back. Her side profile photo, you can appreciate the cheek highlight and the chin position a little bit better. I just don't have it on here, but I will screenshot some more so you guys can see. Also, these are on my page, on our website, all over our clinic, so you can see patient before and afters. Beautiful. She came in, she felt like her upper face really dominated. Her features were full in her cheeks, her nose, her lips, her chin set back. We did filler into her chin to elongate her jawline and balance out her upper to lower face ratios. She's so cute. And she just felt like she looked slimmer. I have other views of her as well. She's like, my face just looks balanced. She came in, we started her on skin regimen, and because she was getting a lot of sun exposure, had a lot of sunspots and fine lines on her face, we did Botox. Her wedding was coming up. We want to still have some, movement around her eyes because it was going to be her wedding. Don't want her frozen face. You can see her before and after. If you look at her forehead lines, they look a lot softer, and she still looks like just fresh and happy, not frozen. I think a lot of people think, oh, Botox and fillers gonna look frozen. All right, she came in, we did under eye filler. She felt like she looked tired underneath the eyes. We did some filler to minimize the appearance of that under eye bag and that darkness. I tell people when we do filler under the eyes, it's not going to change the pigment on the eyes. So you can see she still has some like pigment there. However, it looks a little bit brighter. It reflects light a little bit better underneath the eyes when we camouflage that fat pad. Let me keep going here. She came in, I told her, go get surgery. Like, I can't get rid of your fat pads, the eye bags that you have underneath your eyes. She's like, I don't want to do surgery. Do what you can, the best you can. So we did some filler underneath her fat pads to camouflage the bags. So she came from out of town, flew in from out of town, and she sent me her healed selfie. And like, she looks fresh. Like the eye bags look gone. She looks like she did surgery without having to do it. And she looks so great. She came in and she did some filler underneath her eyes, into her cheeks to create a lateral highlight. We did a little into the smile lines. We did the corners of the mouth. She did lip filler, and she's so funny. We have like lots of really good videos when we did it. Some filler into her chin and her jawline to enhance the side profile. I have other views of her, and she looks great. I don't have them all like set up in this moment. She came in, and again, I treat all skin types, all skin tones, all ages, everybody's background. I'm seeing all the people. Guys, I've been doing this. I do faces. I specialize in natural looking results. This is what my team and I are trained on. This is what we do. Read our reviews, look at our before and afters. She came in, she wanted to straighten her jawline. She didn't want to do surgery. We camouflaged the jowls right here, a little bit swollen. It's not going to be so angular, but because we just finished, but that's it right immediately. Okay, and let's keep going. Here, we got her. She had done a little bit of under eye filler. We've done stuff into her smile lines and then her lips, and she just wanted them to be a little bit fuller. This is Maddie. You guys might have seen her online too. She's a model. She's beautiful. I've been seeing her for a very long time, and she still looks fresh and still looks like herself. And I will tell people no all the time. Like if you ask these patients that see me and have seen me, they're like, if they come in here and they say in the chat, I've seen Ginille for a long time. She will keep it real and tell me no. She's freaking beautiful. I'm like, Maddie, you don't need anything and you get paid for your face. Like just pause. Let's not do it. Like let's keep it still looking like you. I don't want all the faces to morph into the same face. And we see that a lot in the industry. Like we're not trying to do that. She did lips. She felt like her upper and lower lip, she wanted the ratios to be a little bit more equal, whereas before the lower lip was kind of pulled in. You can see her after. He came in, he wanted to have more of a masculine jawline, more squared out. We did some to his chin and then to his jawline. He wanted some more width to the lower face. We also did some filler into his mid face to camouflage under eye bags and then help some of the volume loss that he'd noticed in his cheeks. So handsome. Thank you for sharing. Okay, she came in, she felt like her chin set back. We also did under eye filler, you just can't see it from this side. And you can see her chin before, it like kind of set back. Her lips kind of overpowered the lower face. The chin had some dimpling, so when we did some filler into her chin, look at the jawline after, elongated the jawline, balanced the features for upper and lower face. Instead of the chin from the side profile being set back, it is forward projected. She came in, we did under eye filler to camouflage the fat pads underneath the eye. So again, hey, I can't take away fat pads. If you want to have the fat pads tightened or taken away, go get surgery. However, I can camouflage them pretty good. And here she is after we have filmed, and she's come in recently. This was like a couple years, 2 or 3 years ago. She came in recently and she had lost some weight. And so she's like, I'm noticing a little bit of it, but I was like, dude, you don't look back. She's like, no, I don't look back to that at all. So even after a few years, it still looks fresh. And that's the goal. So yes, these products can last a long time in the skin. That's okay. You want to make sure that it's done right. Okay, some more lips. We did this over a couple sessions. We did some half syringes. When I do it, a lot of my patients will do a half syringe. I'm like, do some, let it settle, reassess. We can always do more later. Give it 6 to 8 weeks to fully settle. We don't want to rush and do much. We don't want it puffy above the border. We don't want to mess up your shape, so go slow. Looks hydrated, looks like her. She has a little bit of fullness. It's not overdone. Especially if you have a smaller lip, we don't want to go crazy on like trying to force it in there. She came in, she did under eyes, and she, again, wanted to camouflage fat pads. You know, I'm like, you want to get surgery? I'm not going to do surgery. She doesn't get puffy. She doesn't have bad allergies. She doesn't cry a lot. She's like, it always looks sunken. It never looks puffy. I never retain water on my eyes. So we did some filler there. Can't get the fat pad all the way gone. I have seen her after, and it looks better than this, honestly. I can't get that gone. If you want the fat pad taken away or tightened, surgery. But without surgery, and for me to be able to do this in like 15 minutes or less, that's awesome. This is her when she's healed and not like poked up. He's come in, oh, he's lovely, and we've done Botox to soften some of the lines in the forehead and camouflage fat pads underneath the eye. I also have really good before and afters of his hair growth. We have done scalp treatments for cleansing out the scalp, like detox scalp facials, and then PRF injections for hair growth in his scalp, and they're on the page. I need to just screenshot them so you can see. He has a really cool page where he teaches you to speak Spanish. It's called Go Spanish Now. You should go check him out. And then here is a woman that came in. She's like in her late 60s, and she just wanted a little lip filler. I was like, look, we don't want to go overdone. We'll give you a little bit. We're not trying to have it puffy above the border. And so you can see all skin types, all skin tones. These are just like some I screenshotted and tried to do real quick before we go on live, just to show different faces that we see. We see everybody in our office, like just straight up. And they're going to get natural looking results. We will tell you if we can't do something. We'll be real about what to expect, limitations of these treatments. But these are the patients. They look like themselves. They look fresh. Oh, he did jawline filler and chin filler. Another jawline. And this is when she came in and it was healed. But her jawline and her chin. More lips. And that's the goal. I'm like, we're not trying to be overdone. We're not trying to morph every face. That's not the goal. But we want it to look like you. We want it to look fresh. Those are the ones that it's like letting me show right now. Okay, let me see. So yes, I have darker complexions. I got all the complexions, period. It is what it is. Did I do anything to her nose? Okay, let's see. Thank you. Okay, what's the average pricing for first-time injections? How much should I be budgeting? So it really depends on what you're trying to do. If you're just trying to come in and like treat one part of the face, it might be, it just depends. Like, it depends. Like the girl that just did Botox for her wedding, I think she's paying around like $750, $800. If they're doing, when I was showing you, a lot of these people were doing multiple parts of their faces, you're going to be anywhere from like $3,500, $7,500, but we might be breaking that up into more than one session. So you get to get here. We did this over some years, but we're breaking this up. I'm like, do some, let it chill, reassess, do more, don't rush it. Like, I'm going to have you looking fresh. My team will have you looking fresh. It's going to look like you. People won't know. If you just saw her walking on the streets, you wouldn't think she's done a bunch of filler, and you really got to see her side view profile. It's so pretty. But like, look, her jowls are camouflaged. These corners of the mouth, it doesn't look sad. Like, it's supported the lips. So I say don't rush it. So we might break it up. Like usually I'll give a price range based on what the person is describing. And I'll say, hey, I tend to end on the lower end of the price range. And then we talk and we see if we should add more, but later. But it really depends on what you're going on. Okay, so that, and we also have financing through Cherry. So you can break up payments through payment plans that people will do. Okay, sorry, I was just talking through those, but I did get you. Come to New York, please. I know I see a lot of people in New York. I've been struggling with consult, but I really want to. And like, don't rush. Like, consults are for you to get information. And I tell people we're not here to like make rushed decisions. We're here to make informed decisions. So even when I went earlier live with one of the patients here, I was telling her what I think, like realistically, what we can and can't do. I was like, nope, you're not a candidate for filler. Hey, you can do the natural filler. However, if you're open to surgery, go get a surgical consult if you would consider doing fat transfer. I want you to know all the information before you decide if you are going to do one. So I tell like, oh, don't just come and say like, I don't just say like, we're going to do lip filler. I want to like really make sure that we understand all the things. Is this about hair replacement? Somebody had asked. So we do have treatments for hair loss, hair thinning, scalp health. So we have a scalp detox facial. We have a whole hair health program. We have a dermatology nurse practitioner also on our team that really specializes in hair health. And so we can help people with prescription medications if they want, Nutrafol supplements for hair growth, we highly encourage. And then in the office, the treatments that we can do are scalp detox facial. So that's where we're really trying to clean out the scalp. Wherever you're noticing like hair loss and thinning, some people are doing just like their hairline, some people are doing their full scalp. It really depends on what's going on. It can be for all skin types, all hair types. So we treat girls with locks, with braids, with weaves. We do all the things. We do men and women, and we have some really good pictures of before and afters of the hair. So we're trying to like clean out any debris from blocking the follicle from being able to grow the hair. So sweat, oil, product, we're trying to get rid of that. And that same day, we draw blood from your arm, spin it in the centrifuge, we separate out your growth factors, your stem cells, and then we can inject that wherever in the scalp where you're noticing the thinning and the hair loss. You will notice new hair growth. Some people at 1 month, but typically I say give it 3 treatments. That's when they're really like, oh my gosh, I see the new hairs, the baby hairs. I just heard it consistently. Look, they're starting to come in. At 6 months, they're really happy. And they're like, sheesh, do I need to keep doing this? Because they're already like in a really good spot. Okay, let me see if there's other questions that I can. This is not AI. You can go. Someone said this is AI. That's so funny. Ask her. She's made videos about it. She's on here. It's Sujia. We have whole videos that we have filmed. She has made videos about it. I can show you all her before and afters from all the things. But I'm glad that you think it looks like AI, Sujia. I see you in here. Somebody just said your photo is AI. Tell them it's not. But it's not. Thank you, Coconuts and Beautiful. Love your natural results. Thank you. Hey, Gina, you're funny to shadow. You can come, message me about shadowing and I will always be here to help you out. About it, how can I schedule a consult for Torrent? So for any of the clinics, you want to do a virtual consult, you can do it at the top of my page. So you hit the link there and then you can schedule a virtual consult, or if you text the number, I see even all the texts that come through, and that's like the fastest way. So the team can help you with getting booked if you want to come in and do in-person consult versus a virtual consult. So the team can totally do that. Do we take insurance? No, we don't take insurance. However, we take Cherry payment plans. And so we also will send you information. You can like pre-qualify before you even come in. And you can still, people will be like, oh, I qualify for $5,000, for $10,000. Oh, and then we do our consult. We talk about the treatments. They might say, okay, your range is going to be $3,500 to $5,000. And then they say, okay, my payment plans, if I choose this payment plan, this is how much it would cost me over the month. So people will do that. I need to go to your website. Go right now. So the website is under Ginille Beauty, GINILLEBEAUTY.com. Or if you just search my name, you'll find it. PDO threads, Tamika, I would not advise doing those. I've been in this a long time. I have not seen enough consistent results of PDO threads of doing much. So maybe the ones for collagen stimulation, but not for lifting. I have not seen, you see how these are just 20 photos, 30, 40 photos of patients I've had. You need to find somebody that can show you a lot of before and afters of patients that look like you doing the treatment that you're looking for. If they cannot show you that, don't do it. And I can show you their immediate before and after. I can show you their settled before and after. I got videos, I've got reviews, and these are just the ones I quickly snapped on my phone. We've got these all day, and whoever you see, if they're doing threads, which I don't really believe they're doing that much, you want to see the results before you get it. Gina said, goal is to treat women of color. Thanks, no experience with lasers and treatments for dark complexion. So yeah, again, we treat all the the skin tones, and it's really important. We need providers of color. We need people that understand how to treat all skin types and all skin tones, because and if you guys go through the studies for the products and all that, I read these, I'm like, they're not including that many people of color in here. I've had the companies approach me like, Ginille, we are doing the bare minimum, like just to pass the FDA trials. We just need a few people of color, and we don't want that. So your provider really needs to understand the product. They need to understand how to get the result in your face, because these products don't perform the same in each face, and these faces are different. A Latina girl versus a white girl versus a black girl, the fat pads are different. You have to really look at it. And if you see, when I do these consults, when people jump on here, I ask a lot of questions. I have to understand them, their lifestyle, what's going on, all these things before I can say, hey, this treatment is right for you. There's a lot of thought that goes into it. And then it's like, which product and how much. I've just done it for a long time. My team, we've done it for a long time. And so we really understand faces. Yeah. What are some tips for fine lines around the eyes? Hey, Kelly. Sujia said, it really is me. Thank you, Sujia, for shouting out. Because someone said you were AI. I'm like, this girl, oh, here's her side profile photo. I love this one. It is her. It's not AI. You can see her in real life. And she looks great. And she's having her birthday upcoming. She looks so good. I'm glad you think it's AI, but it's not, because you can look at the videos and see her face. And we have been taking videos from all of our appointments. It's been really fun. Look at the side profile. Look at the forward chin projection, the softening at the corners of the mouth, the cheek highlight where things look lifted. Yeah. So, okay, tips for fine lines around the eyes. If it's like here, when you smile, Botox, or squint, Botox, and that'll also help minimize the lines from getting etched in. Also, using your sunscreen, using a retinoid, so a retinol or a retin-A, tretinoin, can help with fine lines. And then microneedling is really good for it. Lasers, chemical peels. I'll be flying to Vegas for you, but I need to schedule the works. I cannot wait to see you, Caribbean Queen. Come. I'm in Vegas. I'm in LA. I can't wait. The whole team, they're awesome. Okay, let me see if there's other ones. Do I recommend any products or product lines that you highly recommend? What are the skin concerns? We have a product line, so I only use the products, and I have my patients use our products. So it depends on your skin concerns. So our products are under JASI, JASI, but at the bare minimum, just use a sunscreen that you like and that you will reapply. I really want to have sunscreen that is going to look great on brown skin. So yeah. Kelly, I would love to see you. You're in LA. Yeah, so in LA, we're in Mar Vista and Torrance. Okay, sorry, what am I doing here? I hit some button. I need to take that off. She's beautiful on both. Yay, she looks so great. What did Gina get done? Who is Gina? Let me see. I don't know. Do I have a patient? I don't know who Gina is. Let me see. I don't know who Gina is, but I can hit. I don't think any of these patients are named Gina, but I'll click through them and you can ask. I kind of went through these earlier, but if you want to know what these patients did, most of these patients are doing multiple parts of their face, facial balancing. This patient wanted her nose lifted up. You can have it lifted. You can have it straight. You can have it downturn. I can do whatever. Gia. Oh, Sujia. Oh, what does she do? She's so funny. She's so great. She did her cheeks, she did smile lines, she did her lips, she did the corners of her mouth, she did her chin, and she did right here along the jawline to camouflage the jowls. So it just looks straighter here. So as we get older, these fat pads keep sinking, our jawline starts to kind of hang, and we camouflage those, and she looks so great. Love her. And we've done Botox and some laser chemical pills. She just looks fresh. And that's it. She's getting older, but she's looking fresher. Her 50th birthday is coming up. Okay. If you have more questions, which locations are you at? Someone said, I'm Gina, just asking you questions. I'm in all three of my offices. So I see patients in Mar Vista, in Torrance. I was in Vegas yesterday, and then I was in Torrance, same patients today. So I see patients in all of them. Okay. If you have questions, you can also jump in, and I do consults with people here, but we can do virtual consults if you want to do that through the top of my page, or you can call or text the number at the top of my page and they can help you there. Also do in-person consults. What we focus on in the office is skin health. We focus on natural results. So I'm like, it's going to look like you. It's going to look fresh. Some of these patients I've been treating my whole career. So it's like, I've been treating them since 2013 and like they are aging backwards and you wouldn't know they've done treatment. That's the point. They look fresh. It doesn't look overdone. It's like, you're not going to be able to think, oh, it's because it's not going to be out of place. So I really inject, again, considering the full face when I'm doing it. And how, if I treat one area, how is that going to impact somewhere else? So even when we did Sujia, she first came and we did like some lips and Botox and she was like, can I do lips again? And I was like, look, like if I just keep doing your lips, these lips are going to look really full. Your chin is already like sitting back a little bit. So they're going to dominate and they're going to like almost look ducky. And then the corners of your mouth look kind of downturned. It's going to look like you've done lip filler. And I'm like, you don't want it to look like you've done anything. Enough people are walking around looking crazy. I'm like, you're not going to have you look crazy. And you're online. Like, no, I'm not going to be like, she's shouting me out and I'm doing a bad job. Heck no. I'm like, we got to look fresh the whole face. So we got to consider the full face. Where are we losing volume? Where is the face aging? Where are we losing bone? That's how we inject at the office. We're really considering underneath the skin. We're thinking about you and your features. We're not trying to have every face look the same. That's not the goal. And like we can tweak this to like what the person wants, but I'm really thinking like here, her fat pads, even though she's young, she's feeling like underneath her eyes looks sunken. Where is she losing volume? We will put through there. Her chin, she's like, I don't want it. I don't want the square chin. I want it a little bit more rounded. She wants lips. I'm like, okay, she's young. Her face can tolerate it. If somebody's face is not going to hold, I will tell them stop or no more. Like her face can hold a fuller lip and it balanced the ratios. This girl, I told her, I was like, this is it. We are topped out. We are not going to do more or else it's going to be puffy. Like I can't fit it. So I know limitations. I will tell limitations to the patient where I'm like, don't do anymore. I know limitations. I can't get rid of your fat pad. Only surgery can. I can hide it some. She's like, hey, I'm not going to do surgery. I don't want it. She's young. Okay, we did that. 15 minutes. She's coming when this is settled. I retreated her this day. I just don't have her like settled photos. We have since done some more like years later and like film some videos. I just need to update the pictures. But I'll tell them like, I know what I can and cannot do. And like, we're going to be realistic. She's so freaking beautiful. Christina, I saw her yesterday. I was in Vegas. These are older photos, but we have done cheek filler and this chin filler, lip filler. And it looks like her. It looks fresh. This is when it's settled. So it takes 6 to 8 weeks for your filler to fully settle. Here, she came in. We did filler into her cheeks, her under eyes, her smile lines, the corners of her mouth, her lips, and then I have some different views, but her jawline and her chin to help the side profile. Here, she came in to do under eye filler. I said, go get surgery. She's like, I'm not going to do surgery. I'm like, okay. She doesn't get puffy. She doesn't retain water by her eyes. She doesn't cry a lot, doesn't have bad allergies. So I said, I can camouflage the bags to the best of my ability. She flew in, guys. I see patients from out of town every single day I'm in clinic. So she sent me her afters and like, yeah, you can just see the under eye bags are gone. When I treat it, I'm going here. I'm trying to hide the bag here, not just here, but I'm thinking about the whole thing here. And I got to hide back here too. Because if I only lift here, that's going to be cool. And then this will be sunken. A lot of injectors, I feel like do that. Like they just treat this line. And I'm like, it looks off. The patient doesn't know how to explain it. When they come, they're like, I did my under eyes, but I still look tired. I'm like, yeah, because they did an incomplete job. They went right here. And they didn't treat this lateral part. Like I got to treat the full eye, like the entire thing. She did under eye filler. She did some Botox to soften some of the lines in the forehead. You can see she still has expression. She still has a little bit of lines when she smiles. Looks fresh, looks like her. You wouldn't think this girl walking down the street has had a face full of Botox. That's the goal. Like I want it to look like you, never overdone. It's going to look natural and you're going to maintain your features. So again, for treating a lot of women of color, they're like, I don't want, like, I like my features. I don't want to morph into the same face. Like not everybody here is trying to be, the number one celeb face. Not everybody wants the same thing. And I'm like, that's good. Like we want to have it look like you. We did some filler into her jawline to bring it forward. And like when they see it, they're like, I feel like this is how like I was born. I feel like I should have been born this way. I'm like, that's the goal. Like it looks like you. It doesn't look out of place. No one is going to see this girl if you hadn't seen her before photo, but if you just see her walking down the street, you're not going to think she had work done. No, you're not. You're just going to think, oh, she's pretty. Cool. She doesn't, yeah, you're just going to, that's it. Like she's a pretty girl. That's the goal. But yeah, we have built up her jawline. Like this to me looks like a surgical result of getting like a chin implant, but we did this in 15 minutes. And So same for her. She had lost a lot of volume. She'd lost a lot of weight after she lost 100 pounds. And so she felt sunken underneath the eyes. We did some in the smile lines. She wanted fuller lips just for a little oomph. And then we did some filler into her chin, had a more square chin. She wanted a little bit more heart shape and to bring her chin forward. Somebody said for jowls, I think Sujia's shows really good for jowls. I have other ones just of like other skin types and tones to show. Let me see if they're on here. But this one I just have like pulled up right now, and you can see it from here. So jowls are when we have this fat pad like kind of hanging and our jawline doesn't look straight. It's kind of like hanging through here. It just happens with aging. And you can see, so I did some into her corners of her mouth. I did her chin, and then I camouflaged the jowls. So people are like, what can I do? I'm like, I got to kind of like treat all the surrounding areas. Other things I've done for jowls, and I have good photos of too. Kybella into like the fat pad right there, and then some filler right there along the jawline to camouflage it and into the chin. You can't just put filler here. If you just put filler here, I would have made her face wide and boxy. So I had to elongate her chin a little bit to get, or else this would have been a boxy after result. And then you can see her from the side profile, like, look at her dang jawline, looks straight. She's always like, should I do more chin filler? I'm like, no, you look so good. Like, we want it to look like you and fresh. And I'm looking, like, my patients, if they're on social, I treat a lot of creators on TikTok, a lot. And I'm looking at their videos. I'm looking at like how light hits off their face. I'm like, they're not about to look crazy, and I'm not going to be responsible for them looking crazy. So they have to look good in all the angles, in every angle. And like, that's the point, not just here. And the world is seeing them out and taking pictures of them. I'm like, you're gonna look great, like, period. What to do for marionette lines. So she's somebody that did marionette lines. You can see her. Marionette lines are these corners of the mouth. You can see them softened. As much as we can soften them out without it looking puffy. So when we're thinking about the lower face, and this is such a good like example of it, I tell people, it's not just, people want their chin. I'm like, I'm not just treating here. I gotta like camouflage here, and I got to do this. That's why it can take multiple syringes. So they're like, well, I did a half syringe like when I went somewhere, but I didn't see any change. Or the worst is they just did a half syringe right here. I'm like, freak, that looks so bad. This person is walking around with this ball of filler, and this is sunken, and this looks deep. And my eyes as an injector is like, who did this to this person? Like, stop. But really, like, you gotta treat the whole area or else it's gonna look weird. Let me see if there's other marionette lines. That's the biggest thing that you wanna think about. Mine is genetic. Yeah, I know, some people just have it. And so it's not, like, I don't know without seeing you, you don't want to try to overfill it. If people are just like trying to chase it, you can see even her, she still has a little bit of line. This left side of her naturally, this is her left side on the side, naturally was a little bit deeper. I can't get it all the way away. I mean, I can get it all the way away, but then I don't want it to be puffy. So I'm gonna be like, I know the limitations. It's gonna look normal to have a little bit of a line. It's gonna look age appropriate. It's gonna still look like you, but I don't want it to be looking weird because I was just trying to get the line all the way gone. So that's especially for smile lines. People are like, smile lines, get my smile lines away. I'm like, you're gonna have a little bit of smile line. Like, you're gonna move your face. That is normal to have some smile lines. If we chase smile lines all the way gone, it's gonna look puffy. She will tell you, I told her, she's freaking beautiful. Smile lines, like, you're 5, get out of here. You don't have smile lines. You look cute. What is for smile lines? You can do filler, or you can do the natural filler. So filler will give you the immediate. Do you think filler after DAO left smile line is a good move? So again, smile lines, you can do filler, you can do natural filler, the one made from your blood. Draw your blood, spin it down, separate out your growth factors, your stem cells, heat it, cool it, and make a gel. Wherever we inject it, it's going to lift and soften that line, and it's going to make new collagen over time. So it just gets better over time. Do I think filler after DAO left smile line is a good move? I don't know what you're talking about. Maybe Sujia, she could do, I mean, I think I did a little bit more on her filler, but not trying to get it all the way. Thank you so much. Someone said I do sick and tired. Girl, I was sick and tired. I need to put my before and afters of my tired eyes. Those get a lot of attention. I just didn't screenshot them to be prepped for this. I was sick and tired of looking tired when I had my first kid of He's now 11 in a few weeks, and I looked so sunken and had no fat in my face because he sucked all the fat of me after I breastfed him for 2.5 years. I'm still breastfeeding a different baby. I've got 3. And this time around, I've been doing the natural filler, so I don't feel so sunken, and I'm older. So my oldest is almost 11 next month. This one is 2, and I have a 4-year-old. And every time I breastfeed, I'm like, dang, I look hollow, like I lose volume. But this time I've just been doing the natural filler. I haven't had regular filler in 3 years. I've been doing the natural one because I'm breastfeeding, and I like it. It got better over time. I will say at first, I was like, I don't see any change. It got better over time. So I like that one. Okay. How long does jawline filler last? So in general, I tell people for any like filler, I'll say 1.5 years, 2 years. However, most people are going to get longer out of it. It depends on how much is there. It depends on what product is there. It depends on how you metabolize it. So, and then even when people come in at that like 1.5 year, 2 year mark for maintenance, it's not that we have to like, I'm typically not doing like the same amount for their maintenance. I'm doing like half. That is what I have seen over the years. Like we can do half of the amount and it works well. Kat said, I went to a cosmetic surgeon. She said I wasn't a good filler candidate. So if you're not a candidate for filler, could be for multiple reasons. I don't know without you telling me. But if somebody gets like puffy around their eyes, if they swell, they cry a lot, allergies, not good candidates for filler. And then that's when you can do the natural filler. Maybe your surgeon could also tell you like what the surgery is that they recommended. I'm not for sure, but if you want, you can jump in here and I can look. Okay, I need this. You look great. Oh, thank you, Capri. I still feel tired. I hear these children in their footsteps. But yeah, I feel like it just has helped me look fresh as I've gotten older. I'm 5'9". I have like a thinner frame. And so for me, when I like lose weight from breastfeeding, I kind of look skeleton-like. It just looks like kind of not great. I look gaunt. And so I like the natural filler. I feel like it doesn't look filled. I also don't have to go through like the exaggerated phase. When you get filler, it can look a little extra for the first, 2 weeks, and then it settles out. So I don't have to go through that with the natural filler. It settles nice after like 3 to 5 days. Okay. I had filler for around my mouth and it looks puffy. It's been 3 weeks. So D said that. Around your mouth, let me know where. In general, filler is going to be a little swollen, maybe bruised, 2 to 3 weeks. And then after that, it should be settled, but like you might feel it. It takes 6 to 8 weeks for it to like completely integrate into your skin. So for D, if you're saying it still looks puffy, is it getting less puffy? Cool. Is it like, if as long as it's trending down, good. If you've been sweating, if you've been hot, if you've been laying on your face, if you've been manipulating it, it's going to kind of prolong your sweat. Flights, salty food, spicy food, that can prolong swelling when it comes to filler. So we do a lot of education about what to expect when you're getting treatment. So we do a lot of education. We want you to prep beforehand. So this is why we consult our people before they come in. I have here, if you want to consult here, we have virtual consults. Like our people come in and they are informed, so they know, they're not like confused, like how much is this going to cost? What are we going to do? No, they come in and they're ready. Like we've talked about what's going on. If they want financing, we've sent them that information beforehand. Like they're set. They're like, oh, I know this is a good time. I know you told me it's going to take 2 weeks for my Botox to kick in. My birthday's coming in 4 weeks, so I have time. If we want to make an adjustment, we can. Oh, I'm not going on any flights. Like we prep. And so this is why I try to get on here and educate. And this is why I also will do education and consults before they come in. And even if someone's like, I can't make it on consult, but I know I want to do something, I'm just coming, we will still send them information on pricing for like, hey, average amount for this area that you're considering is this. We'll still send them, read this pre-care, read this post-care. We're going to ask them a bunch of questions. Is this actually a good time for you? Or are you about to tell me your wedding is tomorrow? Don't come if your wedding is tomorrow. Don't come if you're pregnant. Like, this is why we want you to be informed, not making rush decisions. Okay, I had cheek filler. I got it dissolved. Ever since, my face looks extremely flat. D, I don't know. I need a little bit more information. I'm in LA. I originally went there for filler. She's double board certified. Said filler wouldn't fill hollowness. What part of the face are you talking about? Let me know, D. Yeah, I just need to know what part of the face you're thinking about. Oh, she said your cheekbones were high. I went to a cosmetic surgeon. She says I wasn't a candidate. It's hard for me to know without just seeing seeing you and like, I got to ask like 100 questions. I'm so extra. Because that can cause lower heaviness. Maybe you're talking about here. So maybe then she was considering like a collagen stimulator. So I'm not for sure. Beautiful, obsessed life. I'm in Vegas. I would love to meet you. And I would love to see you. So I'm Ginille. I'm a cosmetic nurse practitioner. I've been injecting Botox fillers, doing skin treatments. I should be flipping through these patient before and afters. Since 2013, I went to Stanford. I went to Duke. I had a lot of student loans, but I am meticulous about what I do. I have teams. I've got 3 offices. So 3 clinics. I've got 2 in Los Angeles. One is in Mar Vista. One is in Torrance, and then one is in Las Vegas. And we see all skin types, all skin tones, all ages. We treat faces. Like, we specialize in natural looking aesthetics. We specialize in it looking like you. We are going to maintain your features. We're not going to have every face looking the same. We want it to look you. We want it to look fresh. We are with our people for years and years and years. Like, I feel like I become part of the family with people. And I do. And then I end up treating their mom, and then their sister, and then their husband, and their brother, and their best friend. And I get invited to their birthday parties, and it's really fun. And they look younger as they're getting older, and they look fresh, and they don't look weird. And I ask them all the time, I'm like, what are your friends and family saying? They're like, nobody knew. Nobody knew. Nobody knew I did anything. They just said I look rested. I look fresh. They asked, did I change my hair? Did I get rest? Did I go on vacation? I'm like, yeah, it's not going to look crazy. Like, it's going to look like you. You wouldn't think if you saw this girl on the street, she's had a bunch of filler in her face. That's great. That's what we want. You wouldn't think if you saw her on the street, you wouldn't be like, oh, this girl got work done. Nope. She looks like her. She looks fresh. She just doesn't look tired. That's the goal. That's what we're going for when we're doing these treatments. Like, even if our girls want something a little bit more glammed up, it's going to be glam, but natural. It's not going to be glam and weird and overdone. Like, they're going to look hot, period. That's just it. Like, look at our patients. They look hot. And these are just some of them. We got pictures for days of the patient before and afters. We've got reviews for days. We've got patient making their own videos for days. Okay, let's see. Does jawline filler improve heaviness for the lower face? It can. Oh, like here's one I just stopped. I feel like people, when I do their lower face, they'll say, you hid my double chin. You can't see my double chin. I hear that a lot. I'm like, I didn't do anything to fullness underneath, but when we elongate the jawline, it can make the side profile look more enhanced and camouflage like the double chin. So people will like that. It can make the jawline, why did it say my live will end? Hold on. I'm not inactive, we're active. Okay. It can make the jawline look more defined. Again, if you saw this guy on the street, you wouldn't be thinking he's done filler in his jawline and his chin, but he did, and he looks great. If you saw her, you wouldn't be thinking she did jawline filler, or maybe you think she got surgery because it looks really good on her chin and jawline is what I did. And she saw this black girl on the streets. Everyone's like, black girls get lip filler? I'm like, I do black girl lip filler every day. She's just like, I'm like, girl, you got lips. She's like, I want them juicier. She said, I want Bratz doll lips. She's like, I want them very full. Okay, we got that. But still looks natural. It fits her face. It fits her features. Naturally, she has fuller nose, fuller cheeks. It fits. Here, lip filler, looks natural. That's the goal. No, I got a lot more noses, and I just think that I cannot scroll back enough on my phone to get them, but she wanted to camouflage the bump. So I have a lot of noses. We do to camouflage a bump, lift the tip of the nose, make it look straighter from the front, make it look a little bit more defined so you can see more of the contour of the highlight. So you do nose filler. Am I board certified? I am a board certified nurse practitioner, yes. And again, I went to Stanford, I went to Duke. Everything I do is going to be legal. Like, I don't play with that. And where am I? I am in Los Angeles, 2 clinics there, and I am in Las Vegas. In Los Angeles, we're in Mar Vista and Torrance. And in Vegas, we're on the Summerlin side. Okay, let's see what this is. Let me hit these new questions. Okay, if you have other questions, you can also jump in here and ask me anything. I'm going to get ready to jump off shortly. But again, if you like, when we want a virtual consult or in-person consult, or people will jump in here and we'll go through their questions right there, or you can send me pictures to the number on the top of my page. You can text pictures. It's a HIPAA compliant line. So it's just me and my team who can answer your questions there. So people will ask questions there. They can send their photos. I can give recommendations. If you really want to talk, that's where I'm like, get on a virtual consult so we can go through it. We're answering questions during the consult, going through what to expect, how to prep for treatments, going through your goals, starting to build out your treatment plan. Then from there, we can send you pricing based on what we discussed. There's pricing is on our website. Like, I don't try to make this stuff hidden and be like, oh, I can't tell you the price till you're in the chair. No, I want you to know so you can be ready and like what to expect. So if you tell me, sorry, I'm shaky, what your concerns are, I'll say, okay, I think based on what we discussed, it's going to be this, this, and this, and we send you a pricing, and it's a range. And so then you can have an idea. So some people will say, hey, I've budgeted for the lower end of the range. Other people like, just do my face. Other people, because I'm coming from out of town. Some people will say, I want to start with my priority, which is X, Y, or Z. You can totally do the priority as long as it doesn't make your face look off balance. Because I'm like, if we do that, it's going to look weird. So we just have to talk through it. And so we just want to be on the same page when we're going about your treatment plan. And then these people, when I'm doing it, I'm like, we're not rushing. We're doing some, let it settle, reassess. We can always do more. So you can see she came back. Like, these are her settled results. Okay, we can. And then she's like, I think she wanted some more in her corners of her mouth. So again, I'm going to be realistic about what I can do. But yeah, we added more volume. She lost some weight, like in through her mid face. We try to create that highlight so it looks pulled back and not the highlight low where her cheeks sit low. We're trying to make it look up. So yeah, these are just some of the faces that I have seen in my clinic. I have a lot more, but these are the ones that I kind of pulled on my phone before I got on here. Okay, if you think of questions, call or text. You can seriously text us. We see them all. You can DM, but sometimes I miss them. Send us pictures and let me know. Had my Cupid's bow done. Turned out really cute. Yes, I like to hear that. You want it to look like you. You don't want to regret these treatments. I tell people, make informed decisions, go slow, do your research on your provider. You need to see a ton of photos and see people that look like you in the areas of the face you're considering multiple times over. Read their reviews, see if they have, do all of that. Don't do price shopping. If somebody's just like, those are the worst. And they're like, I went to this Groupon. I'm like, no. And they're coming to me to fix it. I'm like, dude. And they're like, this would have just been easier and cheaper if I would have just done it right the first time. So you don't want to I was having a consult with somebody today and she has seen multiple providers. And it's just like, dude, this is like you jumping around and doing half a syringe and $200 there. I'm like, no, it's pieced together. It doesn't look good because you're treating one little spot of the face. You don't want that. Do it right. Get a full facial consult. Talk about your skin concerns. Talk about what you're expecting. That's why I ask people, I'm like, are you losing weight? Are you planning to lose weight? Are you getting ready for something? What's going on? So I can think about your facial aging. You work out every single day really hard and you're losing volume. Oh, you're a runner. I'm asking all these things so I can figure out your lifestyle and think about how that plays into your facial aging. And then from there, I'm looking at your face. Where are we losing volume? Where are we losing bone? Okay, if she have a really full face naturally, okay, I'm going to need a thicker filler, something that can actually lift. If I do a thin filler, I can't do the same filler in this girl and in this lady. These are two different faces and they have different amounts of fat in there. So it's very different. I can't do the same filler in this girl versus this girl. It's different. And so people have to understand that. And I think a lot of injectors just inject the same product and I'm like, you can't do that. You have to understand what's going on in the person's face. You have to understand their facial features, their aesthetic goals. Don't rush this stuff. Do it the right way. I've done this a long time. When it comes to your face that the whole world sees and that you see on the daily, you don't want to be just willy-nilly with it and just going with the Groupon. And then I will ask a lot of questions so we can communicate, we can understand your goals. And then again, I'm like, don't rush it. Do it, let it chill. We can do more. We can build on it. If you really like it fresh off the needle, when it's the most angular, it's going to swell, it's going to come down. And then we can say, oh, did you want to do more? Do you want more width? Do you want it more square? We can always do more. You can also dissolve, but just don't rush it. And that would be the better way to go about it. Who wants to do stuff and then have to dissolve it and redo it? That's going to be annoying. Gina, can I get a live consult here? Yes, I'll do that. And then I will go on. I will leave. If you want to do it now, we can. But yes, people will jump on here and we'll talk through their questions. Otherwise, I'm going to jump off for the night if you don't want to do it right now. And oh, she says she's here. So hey, Gina, and then we'll talk through. Did I add you? I'm so sorry. I'm not that great at this part. Okay, let me see, and I will answer any questions you got. Can you hear me?
I can hear you.
Okay, let me see if I can, I think I have to put your camera on. Yeah, I don't know. Sorry. Oh, hi, you're so pretty.
Oh, thank you. Oh, I'm so excited.
Expand it, okay. Cool, I'm glad we have time to chat. Nice.
Yay.
And you're a provider too?
I am. I'm a nurse practitioner, but side note, I'm also getting married
Oh,
in July.
okay,
So I'm getting older. I need some things as well.
okay. What have you done?
I have done nothing. So I've just done talks, but I'm really overdue for that. But that's the only thing I've ever done.
Okay.
Yeah. So,
And
and I'm
then what?
completely open to it all.
Okay. Um, this is your standard weight, not like changing weight or planning to.
No, I've actually lost a bunch of weight. I was about 200 pounds and now I'm 140. So
Okay.
I'm pretty much where I want to be. So I don't want to get any smaller.
Okay.
I'm at
And
my
then
goal.
okay, great. How old are you?
I am 48.
You're so
Ah,
pretty.
I hate
Okay. You're
you.
so
Thank you.
okay. And then are there changes you're noticing on your face with like
The
after weight loss
biggest
and just with aging in general?
Oh, yeah. I think the biggest is here. So I can see
Okay.
that I've just lost because when you're bigger, your face is a lot fuller. So
Mhm.
definitely like the temples I could see, the cheeks I could see, and then here a little bit with the chin. And I have a little dimple in my chin too that hopefully it'll go away.
Okay.
But
Okay.
just here that I've noticed. So chin, cheeks, and then
And temples.
here and temples.
Okay. And you naturally have like pretty highlight on the face. But yes, as we, as we get older, we start losing it. Fat pads start separating, they start sinking. And so I treat a lot of women of color that naturally have fuller, thicker skin, fuller cheeks, more fat in their faces. But they can still sense when change happens. Like they can still know when things are not as lifted. So I think for
Right.
you, and you're a provider, so you're gonna like understand products. I would use Radius, like a thicker filler. You want something that is going to give the most lift. And so I use that on a lot of women of color or people that just have more fullness in their face. It mimics bone. And I would
Hmm.
focus, and I can see it very subtle, like more highlight here on you. And we're trying to get that highlight to go back. So I'd focus a little here and then lateral. And then for here, like corners of the mouth to soften, you can use Radius, like dilute Radius, or you can do something a little softer, like contour or something. Just so if we lose volume, the marionette lines, they'll start to look downturn. People feel like their
Hmm.
corners of their mouth go down, they look sad. So you can soften there. And then can I see you from the side profile? Can you turn to the side?
Yes. Here, maybe this side is better.
I mean, your chin position is really pretty. Like it's not like back or anything, but if you're just trying to hit a little highlight, oh, you said the
Yeah.
dimple.
Well, no, I feel like too, as you age, I feel like people get this little area of their chin, like right here, that looks like it's separated from the face. So you know how like when you did Sujia's face, she was like a prime example. Like it looks like all like just
Mhm.
one beautiful unit.
Yeah, so
So
we'll do
that's why I
like
feel
right
like there's like a
into
little
here.
something weird going on here,
Yeah, so it's
which I
subtle.
don't
I would
like.
go like right along the bone, like in front of that jowl, fat pad, like right here,
Hmm.
and then a little highlight. Because if you do this, you don't want it to look wide. I can see it very subtle on you. It's not like I feel like Sujia's was more, but where you just like lose a little bit of the light on the jawline right here, where it kind of
Uh-huh.
dips in, so you can make that straighter. But if you do that, you probably are going to add a little into your chin so that it doesn't look wide right here. Um,
Yes. Okay. And I love that when you said like using different fillers for different people and different types of skin, because they don't teach that. I feel like they don't teach that. That's
Look at
something that
who's
I hadn't even heard before.
but like look
People
at who's
usually find
teaching
a
it.
filler.
I know.
Yeah, no,
Look
this
who's
is
teaching
true.
it.
So I'm so happy that you said that here,
Yeah.
because I mean, I love that.
I have like I've just been in it a long time, and I have worked it previously like with a provider. He's like a trainer like all over the world, and so I have had like access to the top trainers all over the world. I'd be tagging along with him back when I was with him, and so I know a lot of people, but I'm like, when they're talking, I'm like, who are you treating? Like, you're only treating women. I'm like, I ask them like, who are your patients? And they're like 50 to 70-year-old white women. I'm like, yeah, we are not talking about the same
Hmm.
thing. Like, you told me to only use a half syringe on their cheek. That's not going to do anything on a black girl that has fat in their face. So, and I'm like, that product
Right,
is too thin. And I feel like a lot of black women will come and they're like, I went somewhere, I did one syringe, I didn't see a change. I'm like, what product did you use? I can look at them. I'm like, I already know what they're gonna say. And I'm like, that's too soft for your face. Like it's just gonna, they're like, it's gonna look pudgy. And they're like, that's what I felt like. My face just looked pudgy, but didn't have structure. And I don't think
uh-huh,
the industry talks about it a lot. I don't think there's a lot of people that treat people of color. And so they don't really understand the products fully, or they understand them just how the company trains on it and not,
right,
look, if you have access, you have all the products, like read through how many people of color in these clinical trials. And I used to be in an office where we were doing trials and trials and trials. There's not a lot of people of color in it. They said they do the minimum
right.
to pass through FDA. So I'm like, they're not even like practicing with it in faces that look like ours, you know?
Right. And I also think it's important too because a lot of women of color aren't getting these services because you just feel like, hey, these things aren't for me.
Yeah.
And as I've been in practice, I've noticed that a lot of women of color are just really interested in these things. And it's nice. It's nice to have more information.
Yeah. And I mean, that's why I say shout out to the patients for sharing because I've had a lot of people say, I never saw an Indian woman getting this until I saw yours. I never saw a black girl that looked like me. Oh, I didn't even know black girls could get lip filler. Like I wanted it, but they only show me like a white girl's lip. I'm like, I know. So this is like for the patients that like have allowed us to share. I'm like, guys, this is to educate others that like we can get the treatments. It can be safe for us. You can have a natural looking result. It can still look fresh, but also do your research and go to somebody that really understands you and your features. And we don't want all the faces to be morphed looking the same and the products don't perform the same. I know because I had it happen to me. Like when a product came out years ago and I was working in a practice and they did everybody's cheeks, all the girls, the white girls, they're like, oh my gosh, it's so cute. And it lifted. On me, they did like, we don't see a change. They kept adding filler. And I was like, I don't see a change. I look pudgy. And I was like,
Oh, no.
yeah, because it's too soft. I was like, that soft HA filler is not doing the thing. So
Oh, man.
yeah, we can.
Yeah.
You're in LA.
This is good information. I'm in San Diego, actually.
Okay, so you're still here. Yeah, I know you. Come to the
Yeah.
clinic and we'll talk through all the stuff. But
Yes. All right.
definitely,
Sounds good. Well, thank you.
yeah,
Very
for sure.
informative tonight. Thanks for coming on live. You do
Thank
great
you.
work. We all love your
Oh,
work. And I follow Sujia, so I've seen her from before she saw you. She looks great.
oh, thank you so much. Okay, I will see. Yeah, come to clinic
All
and
right.
we'll hang out and we'll talk about all the things anytime.
Okay. Thanks.
Bye.
Bye.
Okay, and then if you have other questions, I don't know how to turn off, by the way. Sheena, you might just need to, I don't know, click off because I don't know what to do there. Um, if you have other questions, again, you can jump on there. But Gina was another aesthetic provider, which is really cool in San Diego. I love seeing like women of color in the aesthetic space. Like the industry is growing and we just need more people that understand treating people of color. And yeah, that's really important. Whoa. Okay, I'm going to jump off. If you have other questions, you can. I don't use peptides yet. I want to make sure everything I do in the office is FDA approved. I don't jump on things when they're brand new. I've been in this long enough to know peptides we do Zep bound, but there's a lot of peptides and where people are doing all kinds of really cool things with them. But I'm like, I just need to know, I need to let the dust settle and like hear about it and the safety of it. And then really big for me is just, do these treatments, which peptides I think will work fine, but like work on skin of color. When it's a laser, when it's a new injectable and all of that, I'm like, how is this going to perform for people of color? But yeah, let me see if there's any other questions before someone said I'm beautiful. Thank you. I appreciate you. I did the consult there. If you think of other questions, you can call or text the number at the top of my page. You can set up your virtual consult there. You can send a DM, but sometimes I miss them. So texting the number, you can text your pictures, you can ask questions. I'll see it there. And then, yeah, like come see the team. Like I said, we got 2 clinics in LA. We got 1 in Vegas. We'd love to see you. We focus on skin health, hair health, natural looking results, all skin types, all skin tones. It's going to look like you. It's going to look fresh. We're going to develop a treatment plan. This is not going to be rushed, and this is going to be very thoughtful when it comes to how we treat your face. Okay, I will talk to you soon. I appreciate you all. God bless you. Have a great night, and bye.